Hello, everyone. My name is Natasha Davis, and welcome to Week 5 presentations. The topic I did my presentation on is immigration. I would like to discuss the language barrier, which is the problem in Latina children in which they face in assessing mental health services in the United States. Immigration has changed America. It has impacted positively by introducing new ideas, food, and changing the culture. Immigration is an asset to America. I would like to share a short film on the history of immigration.
This is a story about U.S. immigration policy. The goal has always been to identify which people to welcome and which to keep out. Let's start in 1790. The first immigration law passed limited U.S. citizenship to any free white person. The law thus excluded people from almost anywhere outside of Europe, not to mention enslaved Africans and Native Americans who'd been living on the land for centuries. As immigrants of color began trickling into the country despite such restrictions, U.S. politicians moved again to officially favor white people. In 1882, Chinese were prohibited from coming here. And in 1924, Congress instituted national origin quotas. More than 100,000 visa slots were reserved each year for people coming from Northern Europe, while people from Asia, Africa, and other parts of the world had tiny allocations. Because migrants generally follow the example of family members and acquaintances who've gone before them, Europeans dominated the immigrant flow year after year after year. Those national origin quotas stayed in place until 1965, when they were finally abolished as racist and discriminatory. Under the Immigration Act of 1965, priority was given instead to immigrants who had spouses, parents, siblings, or other family members already in the U.S. Some politicians thought this family unification policy would still favor white people because they were more likely than non-whites to have U.S. relatives. But they miscalculated. By 1965, Europeans were largely content to stay put. They were no longer lining up in large numbers to move to America. It was a different story in the developing world. People there were increasingly eager to escape poverty and war, or seek economic opportunity in America. That's where the long lines began to form. For every student or worker who got a visa to come to the U.S. from Africa, Asia, or Latin America, there were many family members back home who wanted to follow. This is what President Trump refers to derisively as chain migration, and it's become an explosive issue. The foreign-born share of the U.S. population has risen from 5% to 13.5%, with nearly 9 of 10 new immigrants arriving from countries outside Europe. President Trump wants to move to a merit-based system where immigrants with the skills and training most needed in the U.S. are favored over people looking to reunite with family members. Such a shift, however, would mark a sharp departure from what has been the prevailing pattern of migration throughout the country's history. Tom Jelton, NPR News.
According to the United States Census Bureau, Latino families comprise more than 55 million of the United States population. The prevailing language barriers have decreased the risk, hindering people from utilizing and accessing mental health services. As a result of the low utilization, there is statistical proof that 88% of the the total population of Latino children suffer from unmet mental health conditions. The language barrier is one of the risks facing Latino children in the I have learned that children become isolated, hopeless, and antisocial because they feel that they can't talk to anyone or because they have a language barrier, especially to social workers, police officers, and other officials. These feelings can lead a child down the wrong path, causing depression, anxiety, and other mental illnesses. There are some experiences or situations where presently limited research has been done to address the disparity among Latino children, assessing and utilizing mental health services. However, in recent years, the U.S. population has diversified mental health needs, notably by implementing the Affordable Care Act, known as ACA. This development has increased access to mental health services by employing bilingual caregivers and providing medical covers to solve the financial constraints. According to the research, it has impacted Latino children as this policy collaborates with schools in addressing mental health symptoms and improving education outcomes. The website to obtain health care is www.healthcare.gov/getcoverage. The Affordable Care Act is a comprehensive healthcare reform law that was established in March of 2010. It was previously known as Obamacare. The law has three primary goals. It will make affordable healthcare available to more people, depending on households, and also give tax credits. Expand the Medicaid program to adults that are not able to afford them. And also, too, the Medicare delivery is designed to lower the cost for all healthcare in general. The way that individuals can enroll in healthcare is by selecting a state. And also, there is a quick start guide where you can get tips. You can see the plans and prices of how much you will pay. You will also be able to see how much you will save. And if you're not sure how to even go on to apply for health insurance, you can also apply for or find local help. I have learned that most fall underneath CHIP. This program was designed to ensure that all children are not left behind when receiving health insurance, which includes mental health services. Due to the growing population of Latinos, every social worker will likely encounter these challenges in settings such as schools, places of work, community-based agencies, and mental health facilities. Social workers must devote themselves to researching the postulated potential hindrance, enrolling in bilingual training, and engaging in an outreach program to create awareness for mental health. I have learned that social workers must continue with trainings in their practice due to constant challenges. I am also learning that no matter how much training you receive and how much education you have, working in the field is different when a stress or crisis arises. Increasing more bilingual professionals will help children to learn at their own pace. These language barriers prohibit children from learning at their own pace or the same pace as English speaking children. At a micro level, a social worker can incorporate a range of communication techniques, such as touching and drawing, and use of symbols as an intervention against the language barrier. As social workers, we should increase our cultural competence, particularly in recognizing the existing gaps. I am learning that children that with communication barriers are often a target of bullying and have difficulty making new friends. Children also have a difficulty with learning and competing with other English speaking children. On a macro level, the government should invest in more in closing the disparity in mental health services among Latino children whose parents have limited English proficiency. This should include logistically appropriately services in mental health, such as training and provision of language coordinate guidance for children and patients with mental illnesses. In addition, professional interpreters should be available in all mental health facilities, particularly those with high cases of children's mental illnesses. To optimally solve the language barrier, the government should increase the supply of bilingual caregivers and physicians in the mental health department. With the increased Latino population in the United States, health providers and social workers must be knowledgeable in addressing the language barrier and training bilingual caregivers, increasing the number of Latinos in social work, and providing professional interpreters who would improve access and utilization of mental health services among Latino children. Also, it is recommendable that social work practices and government policies emphasize social workers' awareness of the prevailing language barriers and work towards a more should be done on research to identify the structural challenges facing access to mental health services among the minority groups in the United States. Would also like to share my experience of working in a school district as a paraprofessional. In the previous years, I have worked as a paraprofessional with young children who had also had language barriers. These children were also supported by the teacher, a one-on-one paraprofessional, or a teacher's assistant, the school counselor,